when we approach a therapist. The most important thing is rapport. The most important thing is finding someone that we connect with, that we feel like we trust, that frankly we feel like we like and they like us back. And so there is a process of finding someone that we're willing to trust, and we need to put that effort in. We need to be willing. If we're unwilling to like or trust anyone, then we can't go anywhere. So we need to take that risk, but also find someone where we feel like that's possible. And then there's a process in therapy, of course, of getting to know one another, but also establishing safety. When people approach a therapist, they might not at that time be physically safe. And, there might be ongoing sexual exploitation and abuse. They might be in a violent relationship, and there might be a lack of inner safety as well. So they might not feel emotionally safe yet. So there's a process of eskestablishing safety and establishing kind of the boundaries around that in different sorts of ways. Once there's that security, then, for a skillful therapist, there's the opening up and the exploring of the trauma itself in different sorts of ways. In the past, I think in the bad old days, there was a lack of sensitivity to just how flooding that work can be and how overwhelming that work can be. And I think we're now, much more sensitive to taking people at a pace that's safe for them so that they can still live their lives, but also, process trauma. And as people start to kind of mentalize and metabolize their trauma, and then there's a process of kind of what next? As that more intensive trauma work comes to an end, and then kind of what next? What sort of life do I want to live? What's possible for me now that I've put some of these things behind me, and also built skills? There's much more of a focus now on skills building in the context of therapy, so that okay, I still feel shame, but I've got the skills to tolerate shame and manage shame. It's not paralyzing for me anymore. I'm not terrified of conflict in the way that I was. And those skills continue, long time after therapy might have come to an end. So that process for some people might be a couple of years, it might be 5 years. For some people, they're going to need long-term support. They might need to still be talking to someone for 10 years or sometimes for 20 years in really acute cases. But undoubtedly, what we see is improvements in quality of life when people get effective trauma therapy, improvements in quality of life, reductions in hospitalizations, reductions in self-harm, reductions in suicidality. And those sorts of things are happening relatively quickly, within 6 to 12 months of the onset of therapy. And so it's really wonderful to be able to sort of take that story out and to tell that to trauma survivors. But the process of starting that journey, finding the right person to go on that journey with you, that's a really important one.